UMB is dedicated to ensuring equitable access to vaccine across Maryland and Baltimore City. And we are doing that in a number of ways, partnering with the Indian Health Service and Native American Lifelines, as well as our Community Engagement Center, who is going out door to door and finding those individuals who might have barriers to accessing vaccine. It's incredibly fulfilling to help the Native American population in and around Baltimore and anyone who has difficulty accessing healthcare. We're here to step up and fulfill that void. And all of us here, whether it be the volunteers, the staff, faculty, or staff from the hospital, feel incredible fulfillment from ensuring that those individuals have access to the vaccine.
So we advocate for all the urban Indian organizations around the country, and so we're working with the Native American Lifelines and the University of Maryland, Baltimore to make sure that there was access to the DMV area, because there was no access for Native people in this area at all, and so folks were traveling hundreds of miles to their reservation to get access, and that just doesn't need to happen, you know, in 2021. And so we're so thankful for this partnership, and it's been so great.
For Native people, so much is at stake for us. Our cultures, our languages. Sometimes if, you know, somebody is one of the last person that knows a ceremonial song, if they get ill from COVID and pass away, that ceremonial song goes with them. They're just things that we can't replace. So it's really important to protect one another. That's probably the most important value that we have as Indigenous people. Mitakuye Yasin, we're taking care of each other. And so this is a good way to do that, a real tangible way to take care of one another. If you are a tribal citizen, a Native person, and you reach out to Native American Lifelines, we will direct you or assist you in scheduling an appointment through the portal at University of Maryland's website. We have elders in our community who maybe have difficulty navigating a web system, or just people who can't do it. We have a team in place to help people get scheduled, and then we will be here as cultural ambassadors for our community members, just to thank them for protecting our relatives by being vaccinated. That's the most important thing.
The vaccine is a life-saving measure against an enemy that really doesn't care who you are. It doesn't care if you are the President of the United States or the smallest little toddler. And each and every one of our lives, whether you're Native or otherwise, is important to us. And certainly in our Native community, for our elders who are, they are our store of value. It was critical that we protect them so that their knowledge could be passed down to succeeding generations and our young people.
Our urban Indian organizations are a critical partner for Indian Health Service in terms of providing access to care and quality and culturally competent care to urban Indians. And really with the efforts of not only Native American Lifelines here in Baltimore, but also our IHS Nashville area office and the National Council of Urban Indian Health, it really was a strong partnership to look for local relationships to provide access. And I'm really pleased that the University of Maryland here in Baltimore stepped up to that call for partnership. And it's one that I hope that will continue to sustain beyond the pandemic.
Everyone needs to get vaccinated. Everyone. The only way we beat this is together. So all the sacrifices we're making now, staying inside, wearing a mask, washing our hands, those are vital to us all staying alive and getting through this together.